In this video, we're going to go over a postpartum return to run checklist so that we make sure that you're getting back to run safely without increasing leaks, pressure, or pain. We're going to dive into the timeline that it's safe for you to be able to start returning to run, what those baseline metrics are that we're looking for, an at-home self-assessment for your pelvic floor that we can do, and even 8 exercises I'm going to challenge you to do at home to make sure that you're really ready to get back to start running postpartum. Hi there, I'm Dr. Jessica London, doctor of physical therapist, pregnancy, postpartum, and strength specialist, mom to 2, and owner and founder of Your Postpartum PT and Wellness. This is exactly where we help moms heal their pelvic floor and core 100% virtually, whether that's in a self-led option or a private one-on-one support. We can help you whether you're 2 weeks or even 10 years postpartum, so this is definitely the space for you. Make sure you subscribe and even hit the thumbs up so that you can get our weekly free videos and we can reach more women and moms with this high-value free content. All right, so the evidence is actually a little bit all over the place on this one, and it makes sense. We've only been studying women and mothers specifically for so long. What a general guideline theme is that I'm finding consistently among the literature is 12 weeks is a really good appropriate time for your body, your pelvic floor, and your core to be able to heal appropriately after birth, whether you had a C-section birth or a vaginal birth, or even if you've had a more severe injury. It's probably going to be closer to that 4th or 5th month, or even sometimes 6 months for moms postpartum. So 12 weeks is that general guideline that we're working off of. But again, I want you to know that this is sort of vague. It's a little bit gray. Some of our higher level athletes are starting to return to run between that 8 to 12 week mark. And some of those that are just getting into running or had a more severe birth method where they had 3rd or 4th degree tearing or a C-section, they might be waiting closer to that 4th, 5th, or 6th month even. So just make sure that you're always tuning into your body and listening to your body. But typically 12 weeks is the baseline timeline that we're looking at. There are a few things that we also want to be mindful of when we're thinking about getting you to return to run. It's not just going to be about a specific timeline, it's also going to be about how you're managing pressure, what's that functional strength, your endurance, your coordination, your speed, and your strength to get back to return to running. This is why it is very person dependent, and we want to focus more on a functional test, which we'll review in this video, not just a timeline to follow. There's 5 criteria that we look at to make sure that you are baseline ready to get started in a return to run checklist and before we move into those 8 functional movement patterns. Number 1, can you go for a walk for 30 minutes without any increase in pelvic heaviness, leakage, or pain? That's number 1. Number 2, I want to make sure you're not having any pain with your day-to-day lifestyle activities. This could be lifting and picking up the kids or caring for your baby, doing laundry, dishes, getting groceries in and out of the car. We want to make sure that you're not already struggling at baseline with leakage, pelvic pain, heaviness, or lack of endurance. If you are, that shows signs that you really need to focus more on a pelvic floor and core foundational program, a beginner program, so you start building up your pelvic floor and core coordination and strength before you move to a return to run readiness check. Number 3, bladder and bowel habits. Are you straining for, urine or bowel output? Are you having any pain or difficulty with those? If you are, again, it shows us signs that you might not be ready for that next progression to kick it up into running, that you need a little bit more specific support with getting yourself back to baseline without straining or having pain on the toilet. Number 4 is sleep. We want to make sure that you can actually get enough sleep at night so that you're recovered and you're rested well enough to prevent the risk of injury as you're starting to exert yourself further. So the baseline metric for sleep is 6 hours per night. This doesn't have to be 6 hours in a row. It can be interrupted sleep, but we want to make sure that you're at least resting for 6 hours per night to reduce the risk of injury and that your body's well rested and recovered to be able to push it to the next level, like turning to run. Number 5 is we want to make sure that you're eating regular meals, that you're not under fueling, because oftentimes people that are under fueling are not going to be in a place where their muscles are able to take on more load because there is that breakdown and repair that happens when we're growing muscle and tissue. And so it's important that you're eating regularly, you're eating enough food to be able to help your body fuel as you start challenging it more with a return to run checklist. Okay, so those are the 5 basic criteria that we need to make sure that you've mastered and that you're cleared with before we move on to the at-home pelvic floor assessment and then the 8 functional movement patterns from here. So if you pass that test, you are good to move on to the pelvic floor at-home assessment. This is where we're going to focus on speed and endurance and coordination at your pelvic floor. Remember, the pelvic floor does not work in isolation, and so we are going to also be testing different functional movement patterns that test the entire system. But at baseline, we want to make sure there's 3 things that you can do with just being connected to your pelvic floor. Number 1 is, can you do 10 quick pelvic floor pickups, as we call them, right? So when you're doing this, you're thinking about squeezing the pelvic floor, lifting the pelvic floor, and then fully lengthening and releasing it. That part is really important, and a lot of people miss that. So with your 10 pelvic floor pickups, you're going to want to do them with speed. We're testing the coordination and the speed of the pelvic floor during this test. So you're going to do 10 pelvic floor pickups in a row to see how well coordinated and contracted your pelvic floor is and how well in tune you are to your pelvic floor. Why speed? Well, when you're running, your pelvic floor has to be able to quickly make those contractions. So we want to make sure that at baseline, you can at least do 10 pelvic floor pickups in a row where you contract, fully relax, contract, fully relax 10 times. The second thing that we want to try to have you do is a 5 to 10 second endurance hold at the pelvic floor. And with these pelvic floor exercises, it's really great to focus more on the front part of the pelvic floor, where the urethra is located as well. So with these pelvic floor pickups, what you're going to do with the endurance hold is pick up and hold for a 5 to 10 second count. Can you hold in that same position without noticing the slow descend of the pelvic floor? Of course, I want you to slowly and fully relax after you try that, but see how far you can get in those seconds before you start noticing you're allowing the pelvic floor to release and to lengthen outside of your control. And number 3 is to actually cough 3 times. I know it sounds really silly, but this actually helps us determine how you're managing and transferring your pressure in the core system. So when you cough, there's a big downward pressure towards the pelvic floor. I want you to do it 3 times in a row. How does your pelvic floor hold up? Does it feel like something's going to fall out? Do you notice urine leaking? Do you notice pain at all? These are 3 tests that you can do at home to test your pelvic floor to be able to see if it's even ready for a return to run full checklist. If you've passed both of those tests, now you're on to the 8 functional exercises that I find really also are supported in literature as well to test your body as a system to see if you are ready to start returning to run. So if you can't do all of this now, make sure you're saving this video for later. You're going to be able to pause it, test yourself, and keep moving along with me as we do these 8 next exercises. So the first one being a single leg balance test with trunk rotation, right? So we're going to come up here on a single leg, and I'm going to challenge you to rotate your body side to side for 30 seconds. This looks quite similar to running, right? So when you're running, there is trunk rotation on a single leg. Running is a single leg sport. So for this test, you're going to test both legs, stand on one leg, lift the other, and do a 30-second trunk rotation. Okay, you're going to do that on both sides. What we would expect is no pain, no leakness, no heaviness, and that you have good endurance throughout these movements. The second exercise is a single leg squat. You're aiming to get at least 10 single leg squats without any external support, no hand support, no other leg support. So a lot of people ask me, how far am I supposed to go down? Go to at least 45 degrees, if not a little lower if you can, but you should be able to do 10 squats on each side without too much hip and pelvic mobility going on, without falling over, with really being able to have good core strength, good hips and glute and lower extremity strength so that you can do 10 single leg squats on each side. If you can't, if you notice any pain or increase in pressure or leakage, or notice just that you're really wobbly, this is definitely an exercise that you're going to continue to start focusing on. Number 3, can you jog in place for 1 minute? You're literally going to start a stopwatch. You're going to jog in place for 1 minute to test to see how your pelvic floor, how your core system, how your cardiovascular system holds up over a little longer period of time, right? Sometimes people think, oh, I don't pee or leak when I cough or sneeze, I must be fine. But let's test you under a longer load for a longer period of time. Number 4, we're gonna do a forward bound. And what that looks like is a forward jump where you're landing softly on your feet without having too much increase in pain, leakage, or heaviness. So you're gonna do 10 forward bounds to test to see how your body holds up, and that was number 4. We're gonna move on to number 5, which is single leg hops. You're actually gonna do 20 single leg hops on each side. Again, we're testing for endurance, speed, coordination here. When you go out for a half-mile run or a mile run, we wanna make sure that your body can hold up and it's ready to receive that amount of load over time. So you're doing 20 single leg hops on each side. Again, no increase in any pelvic floor or core symptoms. Number 6, you're gonna be doing a running man, 10 on each side. Looks sort of similar to like this, right? So opposite arm, opposite leg, just getting into that running stance. This is called a running man. You're gonna do that 10 times on each side. Number 7, you're gonna do a lateral bound. So we're gonna test some lateral movement here to see how your body responds and how you can absorb pressure and force going side to side. So for each side, you're gonna test 5 on each side, just like that. Can you absorb the pressure? Do you fall down? Do you notice the hip collapse? Do you know your pelvis is a little wobbly? Do you notice any pain or increase in pressure? This is a good indication that you might not be quite ready yet and still need to work on more of a return to run protocol strength training. And last but not least is number 8. We're gonna go through a side plank position and test your thoracic spine mobility and your endurance. We're really aiming for 5 on each side. So coming all the way up, hand here, elbow's gonna tap on the ground, come all the way up, making sure that your hip doesn't go all the way down, it stays up nice and high. And doing 5 on each side. How is your endurance? How is your strength? How do you feel after doing all of those 8 functional movements? If you've passed all 3 of those baseline criteria, the at-home pelvic floor assessment and the 8 functional movements, this is a sign that you're probably ready for a return to walk-run protocol. I never recommend people just going straight to running. I always recommend a walk-run protocol and progress your running over time. So that means more running and less walking, but you're giving yourself that graded exposure to start high impact for yourself again. If you notice that you are weak or struggling in any of these, we have a complete 12-week pelvic floor and core rehab program and a 6-week return to run protocol for you inside the Pelvic Floor and Core Collective. You can go ahead and check it out in the link down below. If you want to join in, you get your first 7 days for free.